Well, I thought the meeting actually was quite balanced. I was delighted to see that prevention was well represented in the program content, as well as acute coronary syndrome, some important new updates, structural heart disease, some very, very important updates on valvular heart disease, and there were some heart failure specific data that were brought forward. The reason I emphasize the global nature of it, because it is what heart failure is. Heart failure really is a disease state or syndrome that really reflects and touches on all of the different domains of cardiovascular medicine. So being aware, being astute, understanding what's happening in all the different fields allows one to interpret, diagnose, and treat heart failure much better. So prevention is a great place to start because importantly, we know that from the recently released SPRINT data that the advantage of treating hypertension in those at highest risk was in fact a global reduction in cardiovascular mortality that was uniquely led by improvement in the burden of heart failure. These really are the first solid data to suggest that treating hypertension per se will reduce the burden of heart failure. At this meeting, ACC 16, we saw the HOPE-3 data, which have since been published in the New England Journal of Medicine. 3 studies in one, focusing just on the antihypertensive therapy arm. We know that in those individuals of intermediate risk, treating hypertension globally in all comers who had just one risk factor did not really result in any advantage. However, treating those in the highest tertile of blood pressure, a blood pressure greater than 142.8 or 143 millimeters of mercury, there was in fact a modest benefit that led to a reduction in cardiovascular morbidity and mortality. So it extends the observation that in the right patient population, the treatment of hypertension can reduce the burden of cardiovascular disease. So I'm pretty content that we can say with some specificity now that one of the strategies to prevent heart failure is the effective control of hypertension, especially in those at highest risk for CVD and concomitantly in those that start with a higher systolic blood pressure. That's a very good message going forward. Well, one of the advantages in today's world is that we're more connected than we ever were. Doesn't necessarily mean we're as engaged with each other as we should be, but we're certainly more connected than we ever were. So the comments, the findings, the discoveries that are vetted at a meeting like ACC 16 immediately enter the medical marketplace domain, whether it's industry or academics or clinical practice. And so contrary to what it might have been years ago, where one had to wait for hard copy publications to come forward if you weren't at the meeting or word of mouth, now you can actually almost hear the information simultaneously as those who attend the meeting. Nevertheless, it is important that when we reprogram or reprocess the experience like we're doing today, that we take the time to highlight these big picture themes, because for the busy practitioner who doesn't have time to ferret out all the different acronyms and different trials, it's better for someone to say, you know what, we learned a little bit more about the benefit of treating hypertension in the right cohort, and that's a very good message again. You know, I think it is a lesser concept, because what's most important is that everybody gets together and we have the kind of exchange of information that really enlightens, elevates, raises awareness about all the things that are important. I do think that Chicago is a great candidate city for those kinds of meetings. Relatively easy to get to. Chicago is 2 hours away from anywhere in the United States, and most of our European colleagues can get here in a single flight. But I think more importantly than that, Chicago really, in my mind, is a medical mecca. We have a number of major academic medical centers, a number of very high quality private entities, all of whom are pursuing best practices for patients at risk for those with heart disease. And so it's an environment where the culture is very receptive to technology. It's driven by excellence. There are many, many different individuals contributing to the landscape here in cardiovascular medicine. So this is a friendly home, an abode, if you will, for cardiovascular disease. And so I'm delighted that everyone could get here. And I think the weather is just a trivial disruption.